Today we're going to talk about pharmacology. The first thing we're going to discuss is how to calculate drug dosages. If we know we need to give a specific amount, it doesn't do us much good if we don't know what amount to draw up. So I have a couple different methods here to help us figure out all the drugs that we give. The first one is the tried and true method that we learned in paramedic school. It's your desired dose divided by your dose on hand times the volume on hand. That's going to tell you what to draw up. The second one, we're going to go over drip rates. With the dial flow, we don't really deal with the drip rates too much, but we'll review the method there. Then we're going to talk about dopamine, the trick that we learned in paramedic school. And then I'm going to introduce the 10 and 2 rule. It's a great way to figure out your dose for fentanyl, Versed 5:1, and ketamine. The great thing with the ketamine is it gives you a way to figure out your dose, whether it's going to be IV for pain, IM for pain, or if it's going to be for intubation. Then we're going to discuss etomidate, a quick way to figure out the volume that you draw up for that. And then lastly, we're going to discuss the dial flow and what we use it for. But before we get into any of that, I'm going to review how to convert pounds to kilograms. Now we're going to discuss converting pounds to kilograms. We have two methods here. The exact precise method is to take your patient weight in pounds and divide that by 2.2. You can use a calculator on the rig phone to do that. Or the more precise, the more quick mental math method is to divide their weight in pounds by 2 and subtract 10%. So if you look at the examples below for the first method, 180 divided by 2.2 equals 81.81 repeating, or really closer to 82 kilograms. But if we were to do the mental math method, we would take 180 divided by 2, which equals 90. Then we're going to subtract 10% of 90. In order to get 10%, you just place a decimal point right in between there, and that gives you your 10%. So 90 minus 9 is 81. If you look, it's almost dead on. It's not precise, but it's going to give us right in the ballpark for all of our patients. Alright guys, so now we're going to figure out calculating volume to give with our first method, desired dose divided by dose on hand times volume on hand. So what we're going to do is first figure out what dose we need to give. So we're going to take a 180-pound patient and convert it to kilograms like we just discussed. We're going to divide that by 2. It's going to equal 90. We're going to subtract 10%, which is 9, which equals 81. For fentanyl, we're giving 1 microgram per kilogram, so we need to give 81 micrograms. So what we're going to do is we're going to take 81 and we're going to take our dose on hand, which with fentanyl is 100 micrograms, and we're going to times it by volume on hand, which is 2 mLs. So the first thing we're going to do is divide 81 by 100, so that's going to be 0.81. And then we're going to multiply that by 2, which is going to give us 1.62 mLs. That is how we dose fentanyl using this method. Real quick, we're going to review one more way to do it with another drug, and that's going to be amiodarone with a pediatric dose. The pediatric dose is 5 milligrams per kilogram, so we're going to take a 30-pound patient here. So we're going to divide that by 2, which is 15, and then we're going to subtract 10%, which is 1.5, so it's 13.5, but I'm going to round it up to 14. So our desired dose is going to be 14 times 5 milligrams. So that is going to be 70 milligrams total. So 70 milligrams in 150 milligrams times 3 ml, because if you recall, we carry amiodarone in 150 milligrams in 3 ml. So that's how we figure out this dose. So the first thing we're going to do is take 70 and divide it by 150, and that gives us 0.46. And then we're going to multiply that by 3, and that equals 1.4 mLs. That is the amount that you would draw up for a 30-pound pediatric patient if you need to give amiodarone. Alright, now we're going to discuss figuring out drip rates. With the introduction of the Diaflow, we won't have to do this very often, but we're going to review it anyway. So the formula here is to take your total volume, which is the TV, times it by your drop set. Now if you recall, we carry drop sets in 10, 15, and 20, which are typically our secondary drop sets for hanging piggyback medications, which we're going to talk here with the PEDS amio that we just discussed. We also carry a micro drip, which is a 60 drop set, which we use for dopamine. What these numbers mean is 10 drops per milliliter or 15 or 20 drops per milliliter, or finally the micro drip, which is 60 total drops to equal 1 milliliter. So we're going to take our PEDS amio 1.4 mLs and we're going to add that to our 50 ml piggyback bag. So we have a total volume of 51.4. Now really you don't have to do this, you can just figure it out for 50, which is what we're going to do to make our math simple. So 50 mLs times a secondary drop set, so let's say 15. And we're going to divide it by time in minutes that we need to give this medication. Now typically for amio hanging it, it's 10 minutes for adults, but in the PEDS protocol it states we're going to give it over 20 minutes. So what we're going to do is we're going to take 50 times 15, which I believe is going to be 750. And we're going to divide that by 20, and that is going to give us 37.5 or 40 drops a second. Not a second, a minute. And that is how we would give the PEDS amio in 20 minutes. Now we're going to review the Diaflow, which is going to help us out, and we can do the same thing without having to do any of the math. But if you ever need to figure out a drip rate, this is how you do it. Alright, now we're going to talk about dopamine. We hang dopamine with the 60 drop tubing, and we have two dosages that we can give with dopamine, and we titrate them up to effect. The first one is the beta dose, which is what the formula on the right is going to give us. And we give this typically for congestive heart failure or post-cardiac arrest when there's a lot of hypotension. And what the beta dose does is it increases the heart rate, but it also increases the contractility. Now unfortunately with a congestive heart failure, we may not necessarily want to increase the heart rate, but if we can increase the contractility, we're going to make the heart more effective. And if it's beating more at a more effective rate, hopefully that's going to get them out of the heart failure that they're experiencing. And then we have the alpha dose. We give the alpha dose for vasoconstriction, and we typically use this for shocks like anaphylactic shock, neurogenic shock, things like that, septic shock. So think heart for the beta dose, and then think distributive shock for the alpha dose. So the formula on the right, if I were to put it in a formula, it's their pounds times 10% minus 2. Or, more simply, take their weight in pounds, chop off the last number, and subtract 2. And that number there, 16, that is your beta dose. So for congestive heart failure or post-cardiac arrest with hypotension, you're going to give 16 drops a minute with the 60 drop tubing for your beta dose. If you need to give the alpha dose for neurogenic shock, for example, you're simply going to take 16 and multiply that by 2, and that's going to give you 32, which is your alpha dose. When you start at 16 for the beta, if it's not working, you slowly titrate it up. Same thing with the alpha dose. If it's not working, you slowly titrate it up to effect. And that is dopamine. Alright, the next thing we're going to discuss is the 10 and 2 rule. The great thing about this is one simple calculation. It is going to give you your dose for fentanyl IV. Versed 5:1 if you're giving it IM or IN if you don't have an IV established. And that dose there is 0.1 milligrams a kilogram. And it's also going to give us a starting point for ketamine, whether we're giving it IV for pain at 0.5 milligrams a kilogram, IN or IM for pain at 1 milligram per kilogram, or for inhibition at 2 milligrams a kilogram. So the way this works is we're going to take the patient's weight in pounds, and we're going to go with 180 pounds. And we're going to subtract 10% for the 10. So 10% of 180 is going to be 18. And this gives us 162. And then the next thing we're going to do is we're going to move the decimal place over 2 points. So that equals 1.62, and we're going to slap an ml on here. So 1.62 mLs is going to be your dose for fentanyl at 1 microgram per kilogram. So if you remember earlier, 180 is 81 kilograms. So 90 minus 9 equals 81. So 1.62 is 81 micrograms of fentanyl. Now we need to give 8.1 milligrams of Versed, IN or IM. 1.62 mLs, 5 to 1, is your 8.1 milligrams of Versed, 5 to 1. Now the reason why I say it's the starting point for ketamine, because depending on how you're going to give it, you're going to have to do a little bit of work. So for ketamine at 1.62 mLs, this is going to give you your dose at 1 milligram per kilogram for pain, IM or IN. If you want to give it for DAI, you need to multiply it by 2. So that's going to give you 3.24 mLs. This is your DAI. Now, if you want to give it IV for pain, you simply just divide it by 2. So 1.62 divided by 2 is going to be 0.81 mLs. So by doing one simple trick here, you can get your dose for fentanyl, Versed, and ketamine. Alright guys, since this is a relatively new concept, I'm just going to go over a off-the-wall scenario here. You have a 28-year-old male patient who suffered a traumatic injury. He has a head injury. He also has a history of asthma, and he is combative. And he's suffering some symptoms from his asthma due to the trauma that he's experienced. So he's 200 pounds, and we need to sedate him because he's combative. And we don't have an IV established, so we need to give it IM or IN. So what we're going to do is we're going to take 200, and we're going to do our 10 and 2 rule. So the first thing we're going to do is subtract 10%, which is 20. So 200 minus 20, that's going to equal 180. And then the next thing I'm going to do is the 2 part, which is move the decimal place over 2. So he's fighting my partner right now, and now what I'm going to do is I'm going to draw up 1.8 mLs of Versed, 5 to 1. And we're going to give that IN or IM depending on how we can hold him down, so we can effectively sedate him. So after a couple minutes, the patient is sedated, but he's not totally unresponsive, and he's really complaining of pain. He has a lot of pain. We have an IV established now because he's sedated. So what I'm going to do is I'm going to take this weight here, 1.8, and I'm going to draw that up for fentanyl, and that is my dose for fentanyl. Alright, he suffered a pretty severe head injury, and we contact medical control, and they say, you know what, we got the brand new King Vision, let's see if you can intubate him. Now I know that we wouldn't probably intubate a head injury, but this is just for this bizarre scenario. So medical control says, hey, we're going to intubate, and he has exacerbation of asthma. So they say, go ahead and give your dose of ketamine for this patient. So I'm just going to take the 1.8 mLs, and I'm going to multiply that by 2, and that's going to give me 3.6 mLs of ketamine that I'm going to give, and we pre-oxygenate him, and we intubate successfully. So that is the 10 and 2 rule. Now, just as a reminder, I know we just discussed it, but if you take the 1.8 mLs, that's going to give you your 1 milligram per kilogram for pain, IM, and IM. You divide that by 2, which you would get 0.90. That is your IV dose at 0.5 milligrams per kilogram. And then if you take that 1.8 and times it by 2, that is your ketamine dose for intubation at 3.6 mLs. All right, you'll notice that the writing looks a little bit different this time. I realized I forgot to put the etomidate section in, so I had to do it without my stylus. So for the etomidate, it is not a new drug, but it is relatively new to our protocol, even though we had it before. The dosage has remained the same. It's 0.5 milligrams per kilogram for a max dose of 40 milligrams for sedation DAI protocol. So the easiest way that I found to do this is to take their weight in kilograms. So we do have to take their weight in pounds and figure out how many kilograms they are and divide it by 2 and then divide that by 2 again. You could just divide it by 4 if you wanted, but in my head it's easier to divide it by 2 and then have it again. And that tells you how many mLs it is. So since we carry 20 mLs in 40 milligrams, so it's basically 2 in 1, 40 milligrams in 20 mLs. If we had an 80 kilogram patient at a half a kilogram per milligram, we know we're going to be giving the full 20 mLs. So if you look there, 80 divided by 2 is 40, divided by 2 is 20 mLs. So this works for any weight. If they're 50 kilograms, so 110 pounds, you divide 50 divided by 2, you got 25, you divide that by 2, and now you got 12.5 mLs. So with these two methods for the etomidate and the one that we just discussed, the ketamine, you can take all the thinking, well, most of the thinking out of what you need to give for your DAI protocol. Hey guys, last thing we're going to talk about is Diaflow. The Diaflow is a pretty useful tool that we have in our toolbox, and I think it is underutilized by everyone around, including myself. So the Diaflow, it delivers a specified amount of milliliters an hour. If you look closely at the pictures, it can deliver 10 mLs an hour all the way up to 250 mLs an hour. Now the first thing I thought that this would be great for would be our new burn protocol. If you look down here, we have the indications for fluid in the first hour. If they're less than 5 years old, we're going to give 125 milliliters an hour, which we can easily set on this Diaflow. If they're 6 to 13 years, we're going to bump that up to 250 milliliters an hour, which is the max set on one Diaflow. Now, if they're an adult or greater than 14 years, we need to establish 2 IVs to give fluid, and we're going to give them 500 milliliters an hour, set at the max for 250 at each. Now, we can also use the Diaflow for amiodarone as well as magnesium if it comes in a bag. So for the amiodarone, we just put the 3 mLs of 150 milligrams in the 50 ml bag, and we hook it up and we set this Diaflow to 250 and we just let it go. Now it's going to take a little bit longer than 10 minutes. I believe it takes about 12 and a half minutes to give. For the magnesium, it's 2 grams in 40 mLs, I believe, and the same thing. We just hook it up and we set it to 250 and we give it and set it. I believe it's going to take a little bit longer than 5 minutes. So that is what we can use the Diaflow for. Really, there's no more need to calculate drip rates. Now, if you remember earlier when we discussed the PEDS amiodarone, we could take our Diaflow here, instead of setting it at 250 to give it in 12 minutes, we can just drop that in half, and that's going to get us our 20 minutes, a little bit greater than 20 minutes for our PEDS amiodarone. All right, that's all.